My name is Lynda Dean-Duru. I'm a pediatric dentist, integrative pediatric dentist. I help children realize that their teeth tell a story about their health. We look to be more holistic in what we're doing and trying to find the root cause so that parents don't have to go too many places.
Where are you located?
We're in Ashburn, Virginia.
And where'd you go to school?
I graduated from dental school from the University of Nigeria, which is where I'm originally from. And I came to the United States a long time ago now, and I did my pediatric residency practice at Children's National Medical Center in Washington, D.C. We're located in the suburbs of D.C. Been a dentist for over 30 years. I've been a pediatric dentist for about 22 of those, and a more holistic practice for the last 7 years. Won a lot of top dentist awards. We've won a lot of community prizes, community recognition, and a lot of volunteer awards. But we've been top actually for the past 5 years. The 6 we've been consistently voted top pediatric dental practice in our area.
What was most frustrating for you before being a part of our Introverted Visionaries mastermind?
Not being able to express myself so that they can understand what we do as a practice, that being differentiating us from the rest of the pediatric dental offices. That was one of the things I was struggling with before I joined the Introverted Visionary Mastermind group. It was difficult because I would spend a lot of time during the appointments trying to let the parents know what their children were suffering from or struggling with. That was very frustrating. It just didn't feel like we were growing in the direction that we were looking to grow.
Tell us about the hassles with insurance and reimbursements that you were dealing with as well.
The hassles with insurance, that's a never-ending story. So the insurance did not understand how we were practicing. And for a lot of the parents, when the insurance did not cover it, they felt, oh, maybe it was not necessary. And that's very far from the truth.
I remember you bring up also the challenges of not getting paid by insurance. Tell us a little bit about that.
Being the person that I am, wanting to serve children, it was difficult not to do what they needed. So a lot of the times it was being written off by insurance and if it was not necessary. So we weren't getting paid what we deserved, or we weren't getting paid our fees. And worst of all, when they would now decide on how you could treat a child, it was just very difficult for me. And that was very, very hard to be able to have to select what kind of treatment to do for a child. I just didn't feel like it was right.
And you mentioned also it was challenging in terms of, because you had staff, it's not like you were the only dentist as part of the practice, right? And
it's a fairly big practice with a lot of team members. So having to have the insurance write-up some years were as much as $750,000, it just was not much left for us to even see the benefit of our efforts, much less make a profit. So that was very, very difficult. And on top of that, they started to decide on who should get treatment, who shouldn't get treatment, what kind of treatment was necessary and what was not necessary. That was the turning point for me, because I just could not afford or could not deal with personally going to bed at night knowing that I'm denying a treatment for a child just because insurance is deciding what's right for them or not.
Yes, and then to bear the burden of so much write-off, which means you're basically not getting paid, but then you still need to pay your staff, right?
Yes, I was mostly working for my team and barely working for them. And when you have so much money written off for insurance, and you just don't have anything left. So I love what I do. I could do it for free, except there's a lot of bills to pay on top of that. So having the insurance write-offs was really a big issue for us.
What kinds of people do you have as part of your practice? Like what practitioners and support staff do you have as part of it?
We're a holistic integrative practice. We have an osteopathic physician that works with us. We have a lactation consultant. We have a craniosacral therapist, lactation counselor, who's also a massage therapist. So we do have a whole lot of people who come into the practice to help. So our children are getting well-rounded treatment.
When you had decided to become a part of the mastermind, as you were making that decision, how were you feeling? Any hesitation?
I didn't have much of a hesitation because when I saw the advertisement, it looked like it was meant for me. When we have to find people who are holistic minded. And this was one of the ways that I saw looking on the internet and actually having a friend of mine who had done some of the speaking mentorship from Chen. So I was like, okay, I got to give it a try because, we've got to find the holistic minded patients. And if you do, then Chen's the person that you go to for that.
What's changed for you that you're excited about?
Well, I'm really excited about the fact that at this point, we're no longer under any of the insurance plans. So we're really having patients who actually want what we're offering. That's very exciting because then I don't have to withhold treatment for any of the patients, especially dealing with young people who have the potential to grow and be able to prevent diseases for them. We're really very big on trying to prevent sleep apnea. And the best time to do that is as they're growing. And so now patients are starting to understand that. And while they don't expect to hear it from us, they know that their pediatrician is not really the person who's trained to grow their children's faces forward. So we're happy about that.
Awesome. What would you say are some of the things that made the biggest difference for you?
One of the biggest difference for me joining the mastermind group was being able to tell my story in a different way, being able to make sure that the patients are able to relate to my story, and also the ability to find ways to get a patient to say yes. Those are some of the things that I found very important and difficult to learn sometimes, especially when you're an introvert. I didn't know how much of an introvert I was until I actually joined the group. So that was really eye-opening for me. So you do this in a manner that is natural for you. So it's not necessarily that you become somebody else. So it was good to be able to be a part of that group and be able to say, hey, this is my story and this is why this is a passion for me, and have parents be able to get that from me.
What was it like to have the quantum shift coaching sessions with our quantum shift coach?
One of the biggest things that happened for me through the last year was having a coach other than Chen. There was something that was added to the mastermind group where you had a coach and the mindset coach. And, mindset is everything. And sometimes we think that, well, we're good, we're doing it all right. But if you don't have the correct mindset, and if your mindset is not and you're not in tune with what you're doing, then it makes it very, very difficult. Sometimes a lot of us have like limiting beliefs or things that we've known as we were growing up. And sometimes it makes us feel like we can't do what we actually know that we're able to do. But being able to get rid of that mindset or deal with that mindset and be able to accept it and know, oh, yes, this is a limiting belief. I know it so now, and I can do more. So that was really exciting, especially this past year.
And how has that affected you?
Personally, it has given me a need for boundaries, and I didn't know that I needed to have boundaries. I have a better sense of myself, and I have a lot of compassion for myself now. And these were things that I didn't even know that I could or needed in my life, but I'm very excited to be able to say that being able to establish better boundaries is helping me with my team as well, and that way they're not all running all up over me anymore. So that was very, very useful for me.
And how else has that affected your practice?
Oh, well, we're upward now. While I was stuck for a long time, and just being able to have a different mindset is keeping us on the go now and on the groove. So yes, it's made a very positive impact on my practice.
What kinds of different services do you offer as part of the practice? And
We're a general pediatric dental practice per se, more in the sense that we do everything that is related to children. But what we're most proud of is being able to help moms nurse painlessly. In other words, we do what's called infant tongue-tie release, as we're the only ones in the area who are doing it with a different wavelength, 2 different wavelengths. In other words, we help them. It doesn't always have to be cut, and making the parents understand as well what it leads to. So we're following them through as they're growing so we can grow their face forward and be able to prevent them from having sleep apnea, as I said earlier. And we are also doing checking for cavities, but most importantly, looking to see why does a kid have a cavity. And so when we find out why they have a cavity, then the parents are able to take care of that. That helps them so they don't continue to have cavities. We also help the children grow their faces forward through the holistic measures. In other words, we're doing orthodontics. However, we're doing it in a manner that the body is able to make the room for the teeth so that you don't have to force things, and that keeps the body healthier and also the teeth straighter for long.
You have cutting edge technology too, right?
Oh, yes. For over 15 years, probably over 95% of my patients don't have to get Novocaine for their work, for their dental procedures, because we use lasers. We're the first in the area to bring in laser technology, both for soft tissue and for teeth themselves. We definitely have a camera that looks on the teeth themselves that can actually see 2 millimeters beyond our own eyes. So when we do look at them, we're able to see cavities before they actually become very visible, which means that you're able to treat it earlier so you can preserve tooth structure and be a lot less invasive when you do that. Yeah, so we're still the only one in the area using a 3D combing technology where you take a scan in 3D, which you can look at the jaws and the airways and the sinuses, all of those kinds of things, which actually can help predict a child's health and how well they can grow their face.
Fantastic. You also collaborate with other, like an osteopathic doctor too, right? And tell us about that.
Yeah, it's actually the most fun part of our job because sometimes we co-treat, and we co-treat a lot of times for the infants and the children who have the ALF appliance, which is alternate life force appliance, which is something more holistic that makes your jaws grow by making the body feel like the tongue is up. And so sometimes the tongue has restrictions because, as you know, it's attached all the way to the tip of our toes. And so sometimes the restriction is not in the mouth, it's somewhere on your knee or right in the toe or on the hip. So treating with the osteopathic physician, we're both able to, while I'm coming from the head, she might be coming from the legs, and we're able to find where the restriction is for a child and help to release that. A lot of times we also use a laser light technology to be able to loosen the fascia in the process. So yes, it's a lot of fun co-treating with the osteopathic physician.
What do you feel like was your favorite part of the mastermind experience?
Oh, I love the retreats. So I loved the retreats. For me, it was a high for me. And, I remember one of the retreats we went to, and there was zip lining, for instance. And that's something I would never do in my life. I just would not do it. And God knows I was really scared, really, really scared. However, I did it. I did it on that trip. And so I was really proud of myself, and Chen and everybody else was really proud of me as well. But let me tell you, that was some experience. So every time you go on the retreats, you always come home with 1 or 2 nuggets and always something practical that could help. Plus you exchange ideas with other practitioners of the same mindset. So that was really one of the highlights for me, besides the additional coaching that you got.
Yes, the retreats we always like to ideally have something. It's like more bucket list, like, right? That we.
Yes. So it's too bad that we haven't been able to do that this past year, but hopefully things will come back to normal soon.
Yes. How has this mastermind experience been different from other kinds of business trainings that you've had in the past?
This is so different. It's really, really different because it's a lot more personal and it's a more, of course, geared toward the introverts and integrative practitioners, holistic practitioners. And they're a different breed in the sense that there's not many of that kind of mindset. So it's hard to find people like Chen who actually specialize in helping practitioners with that. It's usually very helpful because she has a lot of tips and things that you never even thought about, even for hiring. Sometimes it's not even having to do with your business, it doesn't have to do with life. And I really, really appreciate that. A lot of the regular consultants, they're kind of looking at the bottom line as well. However, it's not in the same manner because this is trying to hone in on particular kinds of clientele, and that's very difficult to find outside of the introverted visionary community.
And with this new expanded awareness, what are you most excited about with your vision?
I'm really excited to be able to have grow a lot of children have who are able to reach their potential. So that's what I'm most excited about. When we start the treatment that we have with the children who are struggling with like ADD or lack of focus or lack of attention at school, and suddenly they come in and they're no longer in IEP, which is that, I forget what it's actually called, where they have to be placed in a different kind of classroom to learn because of learning disabilities. And it was just because they could not sleep well, and they could not sleep well because their jaws were too tight and their tongue were too tight and falling back in their airways. I'm really excited because I've seen a lot of them come back and they're doing better. So we just know that what we're doing is helping. So that's very exciting for me. I'm looking forward to a lot of growth and being able to teach on that at some point.
How did you get into this kind of work anyway?
You know, my first experience with dentistry was actually my little brother, who was a little very young at the time, who had a toothache, and we didn't know what it was, but he was in a lot of pain. I'm the first of 8 children, so he's the only one I would let him carry was me, and being the only girl as well. And so up night, we'll be up all night, be in pain. And finally, when he got the tooth out, it was like a new baby. He was like a new child. So I just asked the doctor there, what do you have to do to be this kind of dentist or this kind of doctor? And he said, well, a lot of work and this and this and that. I said, I don't care. That's the kind of doctor I want to be. So from very early on, being able to get children out of pain was very important for me. Now, going through school and finding that it could have been prevented, now that changed my mindset. I was like, okay, they're never going to have another kid go through that. And that's what's instructed our practice. And not very long ago, I couldn't recover from bronchitis. And I was going from doctor to doctor, 5 doctors to be precise. Nobody knew what was wrong with me. I was actually getting treated for Lyme disease. And I knew I didn't have Lyme disease. And fortunately for me, I met one practitioner and she took one look in my mouth and said, I bet you have sleep apnea. Of course, I rolled my eyes because I didn't quite think I did, but I went for the test and she was right. And at that point, I started treatment with a CPAP. And so that machine that you have to sleep over with the mask over your face. And I felt much better for a little bit. And then I just didn't feel well anymore. And then they said, oh, the only thing you have to do now is to break your jaws so you can push your face forward. I was like, no, not this one. So I was looking for answers for myself that I came up with the fact that you can actually grow a face forward and you can actually tell from the time the baby's 2 days old having trouble latching that they're going to have issues with their breathing and sleep. And that's when, one more time, it's totally preventable. And I was on that mission. I'm not going to let any child just have to have sleep apnea. And so that's essentially what it's been for me. And that's why I don't know how to do it anyhow else. It's been difficult trying to get people to understand what it is and why it's important. And sometimes they think, oh, it's just you just want to make money off of it. And that's not true, really. Yes, I do want to make money because I'm in business, but the only reason I can't let it go is because I know that you can prevent it. So I want to make sure that parents get that information so they can make that choice for themselves. Mhm.
Yes, because it's not about having everybody get it. It's like the people who you look at and they do need it, then they get it, right?
Well, that is true. That is true. Being that I had a baby brother who just had a lot of discomfort, and that hasn't gotten away from my mind. So sometimes I could be a little bit like, oh, you need to get it for your child because I can see and know where it's going. However, I'm just learning to let them come when they're ready. So that's something that I have learned too with the mastermind.
Yes, there's so much of our healthcare system right now is about, okay, there are certain things perhaps in dentistry that are more preventative, but then there are also things that aren't looked at all, which could have an impact on how the child grows. And that's when you can make the biggest difference, not when everything's all formed and then having problems. So
Absolutely.
it's like
Mhm.
it's so you're doing such important work by evaluating kids at that stage and if they need it because they do have a pattern of do have the possibility of progressing into that way more likely than other people would, that they know about options that they can go down the path of to support them.
Yeah, absolutely. And children are our future, and they don't generally tell you when something is wrong. They just kind of get into themselves and go, oh, they don't feel well. They just go into a shell. And what we're seeing is that once we can get them to breathe better and sleep better, they become just who they were meant to be. And that's why this work is important. And being able to spread the message is really helpful. And so a lot of the parents are starting to see it more. So that I'm grateful about. As a matter of fact, the American Dental Association has issued a statement about 3 years ago and saying that dentists should be asking their patients about their sleep. But it's still not widespread because a lot of practitioners don't know. And it's a lot of education that you have to go get, additional training from when you finish school. And not many people want to do that. Mhm.
What would you say to someone who might be like, wait, but it seems like just because it happened to you and sleep apnea, now you're thinking every kid has apnea issues. Like, what would you say to that?
Well, you're right, because I do get that sometimes. And I just say I'm hoping that they don't get sleep apnea. My goal is for them not to get sleep apnea. I'm just seeing the signs that can lead them to develop things like that. And before you even get sleep apnea is an end stage disease. Children are not supposed to move at all when they're sleeping. And a lot of things that happen with children are very common. People think is normal. They're not supposed to snore. They're not supposed to grind their teeth. They're not supposed to trash around when they're sleeping. They're not supposed to talk in their sleep. And so some of those things are things that will lead us to know that the body is not getting what it needs in terms of air. And so that makes it important to figure out why. And so, yeah, so by the time they get sleep apnea means that they stop breathing over 10 seconds however many times an hour. So that's not good. By the time they get to sleep apnea, it is late. So our goal is to get them so before they develop that we can get them from stop grinding, stop snoring, stop restless sleep, and that way their bodies can grow well and as they were meant to be.
If you knew then what you know now, what advice would you give?
If I knew then what I know now, I would probably have dropped insurance a long time ago to start with. And also maybe you found the introverted visionary group a long time before now. So that's those are the two big things for me personally. And of course, if I knew then too, when I would send the children to the ENT because it looked like they were not breathing properly and they had their tonsils and adenoids taken out, I would also have them retrain on how to breathe because the tonsils and adenoids do grow back. And the reason they grew back is because you never treated the reason they got big in the first place, which is usually open mouth breathing or open mouth posture or mouth breathing. Mhm.
And what would you say to someone who might be on the fence?
Someone who might be on the fence about getting into the mastermind group, just drop it. Just go. Just go and trust yourself and trust Shen. You're not going to go wrong.
Well, thank you so much for taking time to be here with us today and sharing your journey. It's really exciting, the kids you're helping, and it's so cool that you're in this cutting edge, the different services that you offer that are cutting edge, and you're also growing and helping more kids so in the area, and I'm super super excited for you. So congratulations, and also being able to let go of insurance, right? Because how does that feel?
Oh, that feels so great. I want to thank you and the group again. And when we're talking to the parents, I just hope that we're able to get our message out. And I thank you and the Mastermind group for helping us in crafting our story and being able to get the word out there. And of course, I'm very pleased that we dropped insurance. A lot of the patients stayed back with us, which I'm very grateful for. And if I had to do it over, I would drop them a whole lot sooner than now, because really, they're not really health. They're not looking for your health. They're trying to cure diseases. And that's very different from the model that we want as a practitioner. We want to prevent diseases. We're more health focused and not disease focused. So that's a big difference. Yeah.
Yes. Congratulations again. Super, super excited for you and proud of you. And thank you so much for being here with us today.
It's my pleasure, Chen.
For those of you who are in a place where you're feeling like you're at a plateau and you just know you're capable of so much more, and you would love to be growing more effectively in your practice so you could have a practice that you're proud of and even be able to free up more of your time to still help more people, but not necessarily be always seeing patients yourself all the time, then feel free to go to introvertedvisionary.com and then click on the request, click on the button that and request a free chat with us, and happy to give you insight into your biggest frustration in your practice and how we can help you grow faster this year. So to introvert power, and until next time, thanks for joining us.
Thank you. Mm-hmm.